Welcome everyone to today's webinar, The Path to Diversification, Strategies to Enhance Your Primary Care Portfolio. On behalf of Becker's Healthcare, thank you for joining us today. Before we begin, I'm going to walk through a few quick housekeeping instructions. We'll begin today's webinar with a presentation that will be less than 30 minutes, and then we will have a question and answer session for another 15 to 20 minutes, leaving you time to get to your next scheduled event. You can submit any questions you have throughout the webinar by typing them into the Q&A box you see on your screen. Today's session is being recorded and will be available after the event. You can use the same link you used to log into today's webinar to access the recording. If at any time you don't see your slides moving or have trouble with the audio, try refreshing your browser. You can also submit any technical questions into the Q&A box. We are here to help. With that, I'm pleased to welcome today's speakers. Brett Jorgensen is the Chairman and Chief Executive Officer for MDVIP. Dr. Andrea Clemess is the Chief Medical Officer for MDVIP. Chris Lillick is the Chief Marketing Officer for MDVIP. John Schmidt is the Executive Director of Health Systems for MDVIP. Brett, Dr. Clemess, Chris, and John, thank you for being here today. I'll now turn the floor over to Brett to start today's presentation.
Welcome, everyone. I'm Brett Jorgensen, Chairman and CEO of MDVIP. Our team has been looking forward to sharing some good news with this group of healthcare decision makers. And good news is something we could all use after an unprecedented global crisis, a pivotal time in history that will permanently alter aspects of healthcare delivery. It's also an opportunity to embrace shifting market forces as catalysts for positive change and to lead through innovation. Today, we'll talk about the explosive demand for personalized preventive medicine and why our primary care business model can support your mission and your financial goals. We are the 20-year national leader in consumer-directed, membership-based care. Although often referred to as concierge medicine, what we specialize in is distinctly different, and it's not healthcare for the wealthy. We help hospital systems fill an unmet community need by enhancing your primary care portfolio. Our enterprise solution diversifies both your service offerings and your revenue sources beyond traditional insurance reimbursements. Based on McKinsey's assessment of COVID's impact, as much as a 30% drop in EBITDA is predicted across for-profit and nonprofit providers. By contrast, MDVIP experienced predictability amid great instability and uncertainty and saw record-setting growth nationwide. As you'll hear from a few of our executives, there's a reason our footprint currently spans 1,100 affiliated physicians and 350,000 patients. MDVIP's expertise from strategy through execution and ongoing operational and marketing support will save you time and resources. You can trust our legally and medically sound business model, our track record of growth every quarter for 2 decades, and our mutually aligned incentives to satisfy patients and doctors. Challenging yourself to think differently to meet changing expectations can help you increase your market share, prevent patient attrition, retain physicians, attract executive health and employer customer base, and stay ahead of the competition. And we are the partner to help you launch a profitable new patient entry point. Now, it's my pleasure to turn the program over to our Chief Marketing Officer, followed by our Chief Medical Officer, and our Executive Director of Healthcare Systems. We'll cover market size, our clinical outcomes, and our turnkey integration. Here to discuss the key drivers of healthcare consumerism and MDVIP's gateway opportunity is our Chief Marketing Officer, Chris Lillick.
Thanks, Brett. Hello, everyone. I'm Chris Lillick, the Chief Marketing Officer here at MDVIP. In this segment, I'm going to expand on some of the complexities of meeting consumer demand in a one-size-fits-all primary care environment, and also touch on the size and potential of the addressable market for personalized healthcare with MDVIP. As some of you may have read, McKinsey ran a study concluding that to succeed in the next normal, health systems need to do a better job anticipating customer needs. Clearly, there are a couple reasons this is important. First, if we give a consumer what they're looking for, they stay a customer. And second, we all know how competitive healthcare is these days. If you can offer a product that differentiates you from others, it's a clear market advantage. So let's talk about consumer demand and what patients are looking for from their physician. The following points are taken from a series of market insight questions rolled out last year, focused on consumer selection factors for various types of care, including primary care providers. The number one factor that beats out reputation, personality, and even providing high quality care is a doctor that listens to me. But what do patients really mean by that? Well, as an example, patients tell us they want more lifestyle coaching from their doctors, so more personalized advice on diet and exercise, for example. Yet 75% of patients say they haven't discussed any self-care with their physicians within the past 2 years. One of the main reasons for this is a lack of time during appointments. 78% of physicians say this is the top reason they don't discuss self-care with their patients. Unfortunately, this is likely a consequence of a volume-based approach to medicine. This can explain why it's so hard to improve the physician-patient relationship in volume-based care. Patients simply aren't getting their number one need of more time and better guidance met. When that happens, patients get frustrated. There's really nowhere for them to go, as almost every physician practices in the same manner and doesn't have the time during the appointment to get to the level of depth a patient wants. Patients also want a better experience when they visit the office. The healthcare industry is the 5th biggest in the United States, contributing more than $1.2 trillion to the GDP. But according to the Siegel and Gale Global Simplicity Index, healthcare ranks dead last out of 25 industries in the US for simplicity of experience. Whether it's long wait times, never-ending stacks of paper forms to complete, confounding language, or overly complex insurance plans, the healthcare industry has become one that many US consumers find lacking from an experience standpoint. And patients are more and more bringing expectations from other industries into healthcare. They want and need it to be easier to engage with the system, and they're willing to switch providers to get a better experience. As customer experience continues to evolve as the last true competitive differentiator in most industries, it stands to reason that the experience must improve, and those who focus in this area and offer more choice in how services are delivered will likely be the winners. This emphasis on customer experience really reflects the fact that patients are starting to behave more like healthcare consumers. Well, why is that? With the rise of HSAs and FSAs, consumers are more in control of their own healthcare dollars than they've ever been. They have more choices than ever of when, where, and how to get care. If you think about the rise of urgent care centers, retail clinics, and telemedicine, which, as you know, has been accelerated during the pandemic. These dynamics have changed people from being passive receivers of care to active participants in their care. And when that happens, their expectations for convenience, personalization, and customer service rise. Pandemic has absolutely accelerated these trends. The health systems that recognize these trends and account for them in their customer experience will be well positioned for long-term success. It's critical for any healthcare organization to stay in touch with the healthcare consumers' ever-changing wants, needs, and frustrations. At MDVIP, we've made significant investments in time and dollars to do that. We conduct our own primary research through our annual member satisfaction survey and focus groups around the country to help us understand healthcare consumer attitudes. We also have research partnerships with expert third parties like Ipsos and Forrester that help us stay on top of recent trends and insights. For example, we recently commissioned a study to better understand how baby boomers' primary care habits have evolved during the pandemic. All of this research helps us better tailor our offering to meet consumer needs, and it also paints a clear picture of the type of consumers most interested in MDVIP. For MDVIP, our core target is the baby boomers. They've never stood for the status quo, and certainly that applies to how they perceive healthcare. There's a subset of the boomers that really see the value in a closer relationship with their doctor. This group is the most educated of the boomers. They prioritize and are willing to spend out of pocket on prevention. And they would say they want to stay as healthy as possible for as long as possible. This group knows that a close relationship with a primary care doctor focused on prevention can help them meet their health and wellness goals. This group of boomers is significant in its numbers. There are about 20 million of them across the country in every market. And more they are seeking out new models of care that will help them live healthier. At MDVIP, we've aggregated a significant amount of data. This enables us to predict the concentration of these patients by physician in your market. There's no point offering a service if there isn't a concentration of patients willing to support the service. John will talk later about the way we approach our analytics with a health system. The key is to find the right physician with the right patient base. And it's not usually who you think it would be. Patients are attracted to MDVIP from all walks of life. The service isn't for every physician or every patient, but it has a place in your community to meet a growing patient need of more personalization and more involvement in a patient's care. Partnering with MDVIP enables you to leverage our turnkey solution to get to market quickly and effectively. And once open, we focus significant marketing efforts through digital channels to attract new patients into the model. By around year 4 or 5, approximately 40% of the patients in your model will have joined from the community, specifically for this new service arm. If you can match physicians seeking a different way of practicing medicine with the patients seeking out a physician with time to listen to them, you've created a diverse and much stronger business model for your primary care portfolio. Now that we've discussed consumer need and the market opportunity, Dr. Andrea Clemes, our Chief Medical Officer, will share with you how MDVIP interacts with our physicians and will provide some insight into physician satisfaction and the quality of care you will experience as a result of implementing the MDVIP model in your physician network.
Thank you, Chris. Chris talked about having a significant amount of data on patients. Well, one of the best parts of being Chief Medical Officer for MDVIP is being able to work with our physicians to publish the data on what they do and its effects. The MDVIP program was built to identify risk earlier, so physicians can partner with their patients to not only treat disease, but to prevent it. We have published 11 articles showing we have better outcomes than traditional practice, and our doctors and patients are more satisfied. The pandemic hit everyone hard, and it still isn't over. According to recent studies, COVID made many reprioritize their health and look for options to get healthier. This was an issue, as many practices had shut down at the beginning of the pandemic. The shift in priorities caused an increase in demand for MDVIP physicians. While most physician practices were still closed, and indeed many still are experiencing decreased patient volume, MDVIP physicians were open and saw patient volume return to normal by June of 2020. Also, while many physicians decided to retire as a result of the pandemic, MDVIP has extended physician careers well past normal retirement ages. This was just as true pre-pandemic. Not only was there a decline in office visits, but we saw decreases in preventive care and screening. Quest published a study showing that early in the pandemic, the nation saw a sharp decrease in chronic condition management, as evidenced by a dramatic decline in diabetes hemoglobin A1C testing. MDVIP physicians did more tests than traditional practice in this time period, showing that our physicians had more engagement with their patients and took better care of their chronic conditions. The pandemic aside, the MDVIP model is unique, and we have shown in multiple peer-reviewed publications that with this model, we decrease unwanted hospital admissions, ER visits, and importantly for this audience, those top 3 things you get dinged for. This model lets the physician be proactive to not only show improved metrics and outcomes, but there's a better relationship between the physician and the patient. Patients want to partner in their health. They want time with their physician and the thoroughness that this model affords. Physicians want better outcomes and healthier patients. Let me give you an example. The MDVIP Annual Wellness Program has a strong focus on cardiovascular disease prevention. Our first study showed that our testing identified 40% more patients at risk of a cardiac event in the next 6 months to 2 years, as opposed to traditional testing. When MDVIP patients physicians identify that risk and have the time, the tools, and the technology to do something about it, they do. Another study published showed that when we identified the patients at higher risk, whether they were diabetic, pre-diabetic, or normal, the MDVIP physician would work with them to bring those levels down and reduce that risk dramatically. An economic model published by a third party looked at our clinical data and predicted we would have about a 10% decrease in cardiovascular events. Recently, a review of Medicare claims substantiated this statement by showing that MDVIP patients had 12% less cardiovascular events than traditional Medicare patients. The statement, join MDVIP and decrease your risk of a heart attack or a stroke, is something only we can say, as it is our annual wellness program testing, clinical curriculum, education, tools, and well, our doctors that makes it possible. MDVIP was founded by physicians for physicians and is continued to be guided by physicians. I chair our medical advisory board, comprised of practicing MDVIP affiliates who pilot new initiatives, develop clinical curriculum that helps the network achieve the great outcomes, inputs into our annual wellness program components, and educates our network. They ensure everything we do is scientifically relevant and clinically actionable. I do want to stress that MDVIP does not manage or own your physicians. They are still employed by the health system under the terms of their employment agreements. These physicians all work independently to help each other. Not only do our patients have better outcomes, they're more satisfied. And in a published study on patient satisfaction, they said they actually feel healthier. And our physicians, well, they're happy and they're gratified. They have the time to make a difference in their patients' lives. And this goes beyond the exam room. Many of our physicians encourage healthy lifestyles by leading the way in educating, whether it's leading a walk with the doc, shop with the doc in a grocery store to educate on healthy foods, or running a cycling club. MDVIP physicians are also great ambassadors in the community. Many are heavily involved in charitable work or are very visible hosting local events. In contrast to MDVIP's stellar physician satisfaction scores, physicians in traditional practice are not faring as well. Many are close to burnout, either due to EMR clicks, prior authorizations, or because they feel overburdened at the office. MDVIP allows physicians to love practicing medicine again. Last year, we conducted a study with Ipsos, comparing the pressures of traditional physician experiences over an MDVIP affiliate. The results were pretty amazing, and in part likely explain how you can use MDVIP as a physician retention strategy in your health system or to extend their careers. As you can see, our physicians and patients are satisfied, we have better outcomes, and we help people live healthier, more vibrant lives. I'll now pass you on to John Schmidt, who runs our hospital partnership initiatives.
Thank you, Andrea. My name is John Schmidt. I'm responsible for leading our health system division. In this segment, I'm going to show you a way to capture an unrealized revenue stream utilizing the current physicians and patient population. So I don't want to dwell on all the business pressures that healthcare system faces. You're already living that on a daily basis. However, the pressures remain and they need solutions. MDVIP is a great solution for you to explore because we will help you diversify your primary care portfolio and uncover a predictable revenue stream you don't currently realize. With MDVIP's best practices, this can be a notable revenue increase. You'll be surprised at the size of the opportunity if implemented correctly. Additionally, as Andrea and Chris both pointed out, when you meet the needs of a consumer and provide a service that patients want, you build incredible strength and stability within your network. Simply put, a more diverse business offering creates a stronger business model. Let's look at the market opportunity again. As of 2019, there are nearly 70 million baby boomers, of which 20 million baby boomers mimic an MDVIP member. This is a sizable number. By completing our initial analytics, MDVIP will demonstrate the size and scope of the opportunity within your market. MDVIP currently provides service to around 350,000 patients throughout the US, so it's clearly a great opportunity with upside. Our turnkey solution to healthcare systems creates a mutually beneficial partnership, taking you to market quickly and efficiently in a virtually risk-free manner. MDVIP has a proven system that works. For the last 20 years, we have analyzed a substantial amount of patient data, providing analytics and operational protocols, enabling MDVIP to recruit over 350,000 patients and over 1,100 physicians nationwide. MDVIP's proven success will provide you the necessary confidence you are working with the clear experts in the personalized wellness space. Ultimately, we have the experience and credibility you can rely on. The question remains, how do you know our model will work for you? MDVIP conducts a sophisticated assessment of your physician network to evaluate the scope of the opportunity for your organization. Using business intelligence software and physician and patient segmentation, we will create a pro forma showing the effectiveness of integrating MDVIP into your current delivery options, generating a revenue stream from a currently unrecognized source. Our focus is to identify the right markets, the right physicians, and the right patients. Once matched, you'll have the building blocks to succeed in a personalized care service arm. Clearly, there are a number of operational needs we'll need to discuss. Once we determine the most beneficial model for your organization, we will implement MDVIP within your physician portfolio, and the revenue stream will start immediately. You will continue to bill for office visits, elective surgeries, labs, ancillary services, etc. That being said, not every patient needs MDVIP. We have a stringent operational protocol to ensure patients that do not join MDVIP transition to other physicians within your network. At the end of the day, there's no cost to investigate, and you will benefit risk-free from our detailed predictive analysis and recommendations. An interesting point to mention, MDVIP has been recognized multiple times by Work Magazine as one of the top 10 executive health programs in the United States. Simply put, there's a great potential to create a joint branded executive health program with MDVIP. Executive health and wellness is a large market and a great way to build trust and confidence within the business community. As you may know, many executives have a specific employment benefit for this type of care, but many executives travel outside of your system service area to receive this care. The natural evolution is to expand to business executives within your community. Executives receive the benefit of a physician dedicated to their needs 365 days a year, as opposed to a traditional executive health plan, which only provides a snapshot of their health on the day they are examined. Surprisingly, many of these executives don't even have a regular primary care physician, making them very recruitable in your physician network. A significant benefit of partnering with MDVIP includes reciprocity throughout our national network of physicians, effectively extending the health system's reach nationally. In closing, businesses succeed by meeting consumer needs. There are other strong benefits to partner with MDVIP. MDVIP's personalized wellness model creates revenue diversification. Our predictable revenue stream is not dependent on insurance reimbursement. Matter of fact, approximately 75% of it is paid for in advance directly by the patient members. MDVIP's turnkey solution and best practices can create a notable revenue increase. Ultimately, MDVIP undertakes the cost of researching, developing, and bringing your new strategic service arm to market quickly and efficiently. Our operational protocols de-risk the process and provides a predictable outcome. MDVIP's personalized wellness models also extends physician careers, matching practice style with physicians' preferred way to practice, reducing expense and productivity loss related to physician burnout and early retirement. When you match this with meeting a strong and growing consumer need, you have a strong and successful new service arm. MDVIP's personalized wellness is the perfect opportunity for your institution to explore with little to no risk. Our no-cost comprehensive assessment of our model helps to make a well-informed decision. In closing, I hope you found today's webinar a good use of your valuable time, and there's a range of possibilities with MDVIP. Thank you for listening, and please feel free to reach out to MDVIP if you have any additional questions. Thank you and have a wonderful day.
Thank you, Brett, Dr. Clements, Chris, and John for a great presentation today. We will now begin today's question and answer session. You can submit any questions you have by typing them into the Q&A chat box on your webinar console. So let's go ahead and get started here. The first question I'll throw out to the group, the attendee asked, the hospitals in our health system don't only serve wealthy patients. Will those areas be able to support a program like this?
That's a great question. Thank you, everybody. To answer that question very, honestly and direct, our program does not only focus on the healthy, the wealth for the health, health for the wealthy. There are patients right now through our analytics, MIT algorithms, artificial intelligence, and again, as we mentioned before, millions of different data points that we reviewed, is we look for patients that most closely mimic an MDVIP member that is willing to invest in our health. So through our process, we're able to identify which physicians, which markets that are most effective for this program, and ultimately how many patients that will go into this. Now, again, 75% of our patients are over the age of 55, and half of our patients members are Medicare patients. So we're very keen on identifying patients that not only have money, but then also have a fixed income in their retirement years.
Well, thank you so much for that added clarity there, and we'll jump right to the next question. So the next question I'll put to the group is, the attendee asks, how will I know which of our primary care providers would be the best fit?
So I'll go ahead and answer this question as well. Again, as I mentioned before, and you'll hear this over and over, is we've had 20 years experience of identifying the right markets, physicians, and patients that would be successful in this model. Our priority is through our analytics, is to really confirm and understand what the goals are of each physician that would like to go into this model. Again, through the results of our analytics, we'll be able to determine which percentage of your physician network will have the building blocks to be successful. And through a survey of your physician network and their patient population, we'll be able to determine which physicians will have the benefits and the building blocks to be successful. So ultimately, this is a three-pronged approach: data analysis, survey, and then a approval process and a validation through your health system on moving forward or not with a physician.
Great. Thank you so much for tackling that one. And I'll roll right into the next question. So the attendee asked, we were thinking of building one of these programs ourselves. Why shouldn't we go that route?
Honestly, the fact is you have the ability to build on your own and have a successful program. But again, through 20 years of experience, we've seen more practices that start developing on their own within 3 years end up shutting their doors. And so again, through 20 years of experience, we again identify the right markets, the right physicians, and the patients that most closely mimic an MDVIP member that will transition into this process. So you can feel confident that you are with the industry leader and have confidence that you're going to be successful moving forward.
Excellent. And then again, right to the next question. So how much time will we need to invest to get this up and running?
So from the first moment we have a conversation, we've recognized that it's about 4 hours of time that an executive team would need to invest in the MDVIP during this process. Again, we do all the due diligence on our side. We're asking you to provide us the data analytics, the data file for us to do our initial analysis. We come back to you, provide you an overview of the results, and identify which physicians are the pre-survey candidates that have those building blocks and potential to have success. Once we complete that process, again, that's when we have the ability to come back to you, identify the physicians that are qualified, and we'll meet the objectives for you to have a successful program. So we recognize it's 4 hours of your time from start to finish. Everything is, the onus is on us to provide you with the right model to meet your successful goals.
Great. I think you've done a great job of sort of laying out how the partnership will evolve and work. And I think this next question is pretty direct and a great one to end on. So then if our system is interested, what are the next steps?
That's a great question. So really, please feel free to go onto MDVIP's website, fill out a questionnaire, provide your contact information, and we'll be in contact with you right away. You can also reach out directly to MDVIP, John Schmidt or Jay Schmidt at MDVIP.com, and I will coordinate with my team to get you in contact and start the initial process. Very simple. We're very attentive, and we look forward to partnering with you.
Excellent. Thank you for sharing those details. And, thank you, Brett, Dr. Clements, Chris, and John. Thanks, everyone, for a wonderful presentation. And I also want to thank MDVIP for sponsoring today's webinar. To learn more about the content presented today, please check out the resources section on your webinar console and fill out the post-webinar survey. Thank you for joining us today. We hope you have a wonderful afternoon.